I recently wrote a blog article on when surgery for the spine might be a better option. A lot of patients I see, quite understandably, are anxious about the thought of surgery to their spine, and at the Spine MDT, our goal is obviously to try and find the least invasive solution that also gives the longest lasting result. We form partnerships with physiotherapists, osteopaths, and some chiropractors in the region so that we can work as a team together to try and achieve that and avoid surgery. And thankfully, most of the time we can. But sometimes, on some occasions, surgery is the least invasive option that can also give the longest lasting result and prevent patients constantly coming back for repeat treatments. So I suppose I'm going to talk about some of those scenarios. Well, if you've got some nerve compression on your scan from either a slipped disc or narrowing of the spine, what we call stenosis, and as a result that gives you leg pain or any neurological deficits in your legs, such as weakness or persistent numbness, then even in those scenarios, most patients do improve within a few weeks. So it's when patients have gone beyond that certain time frame, the symptoms have just got worse and have persisted, and sometimes an operation called a microdiscectomy or a lumbar decompression, where under the microscope and through a very small incision in the lower back, we can remove the fragment of disc that's pinching the nerves or just widen the space around the nerves to create space, and that often achieves a good result. And I can do that through a very small incision through a minimally invasive technique. And the same applies with the neck. When you've got nerve compression in the neck or spinal cord compression even, there are procedures that can be done through the front or the back of the neck, again under a microscope, that can achieve a thorough decompression and fairly quick recovery thereafter. With back pain alone, surgery has yielded poor results over the years, and there's been a lot of controversy about it, with spine surgeons in the past carrying out procedures with a low threshold, and I tend to avoid that as much as I can, which is why I've partnered with various other practitioners that can try and help with that. However, there are some scenarios where surgery might be helpful for treating back pain alone, other than fractures or tumours or sinister things like that. There are conditions where wear and tear of the spine starts to create instability, where you see one bone of the spine move forward over the other. So if we look at the spine here, sometimes one of the vertebral bodies, one of these bones here, slips forward, and then we can carry out x-rays, and if it demonstrates that there's instability, and you've also failed all the conservative measures, such as physiotherapy, core strengthening and so forth, sometimes surgery to stabilise that segment with an operation called a fusion can help with that. There are various methods of carrying out fusion of the spine where you essentially allow two bones to fuse and join together to avoid that instability. The method I tend to use is called a minimally invasive interbody fusion, which is carried out through two very small incisions either side of the back. With image guidance or x-ray guidance, the screws can be accurately placed in the right parts of the bones and joined together, and then the disc between the two bones here is then removed, and in its place a cage, a kind of breeze block, is placed with bone graft that allows the two bones to fuse together. A lot of this depends on how the scans are interpreted, clinical findings from examining you, x-rays again if they demonstrate instability, but it also depends on how well you've responded to other therapies, core strengthening exercises, and things like that. And actually some patients, even with some form of slippage of the spine, with my one-stop clinic, which allows you to have a scan before you actually come to clinic, that way in one consultation we can get to the diagnosis and formulate a plan. And for the majority of patients who don't need surgery, I'm able to oversee your care by partnering with the physiotherapists and osteopaths that I've worked with over the years and gained a trust with, and we liaise with each other as part of the package, and I follow you up thereafter. have a read of the blog. Link is below. Any questions, contact details are below, and also on my website there's an inquiry form, and hopefully I can help. Thank you.